would like to ask you permission to use this video for educational purpose and on the internet.
Yeah, that's fine.
Now, we did a very complex surgery. This is a thoracic fusion of two of the. This bone is starting to grow pretty nicely. And here it is. Look at that. The bone is going across.
And that was a while ago.
That is, yeah. The surgery was
So it's
almost
better.
a year
It's
ago.
even better
Yeah,
now.
this picture is few months back, so it should be even better now.
No.
But no, the surgery was a little more than a year ago.
Yeah, it was last
December
December.
of 2020.
Yep.
And now is the February of 2022.
Yep.
Now, tell me first about your symptoms before the surgery.
Before the surgery, felt like I had gravel on my back. Like, it kept shifting and pinching.
Yeah.
And it was
How
very
bad
painful.
was the pain? How bad was the pain?
Oh, it jumped between 10 to up to 11 sometimes.
Yeah,
It
10,
just-
10 plus. Yeah.
Yeah, it just depends on
Yeah.
what the movement was. Or
Do you remember the surgery?
Yes,
How long did you stay in the hospital?
just one night.
Just one night. So we did what we call the thoracic minimal invasive interbody fusion. We did a minimal invasive surgery because of an old-fashioned surgery would have been much bigger surgery. You stayed one night in the hospital. That sharp pain, when did that go away?
The sharp pain
Initially.
didn't go away. Well, I was under pills too, but
Yeah,
the
yeah,
sharp pain
obviously.
didn't go away till a few months down the road, and then it got a little bit better. It slowly
Mm-hmm.
started, healing better, and
So, and then you start getting better and better, but then you went to activity. What happened?
I went to
then?
work. And then I started at half days,
Mm-hmm.
and that was fine for a while. But the moment I started moving, twisting and
Yeah,
bending
yeah,
is not conducive to.
May I ask
to
what
this.
kind of work you do?
I build buses. I'm a new flyer.
So this is a demanding job.
Yes.
You don't have a little desk job or something. You have a demanding job.
Yes.
So, and then you felt that when you start doing too much of that, some of the pain got worse, right?
Oh yes.
Tell me about it.
Well, about maybe a couple weeks into it, almost a month, it got to the point to where even the bending and twisting, and they weren't giving me anything heavy to do,
yeah.
but even small bending and twisting would affect my back.
So your body was complaining about whatever you did, you didn't like it, and
Yep.
practically wanted you to stop, and you did?
Yes.
How
I called you guys,
Yeah.
and then I had an appointment made up so I could talk to you about it.
how do you feel now?
I feel great.
Okay,
Compared.
so pain now, they're telling me your pain is zero at this point.
Yes.
So you see, you got a really big surgery and you have a demanding job. In a situation like that, even though the surgery is a minimal invasive procedure, one of the danger of that is that people start too much activity too soon.
Yeah.
And I think you're an example of that your body is talking to you, you just have to titrate and to adjust your activity to what your body is ready to have. And when you comply with that, it works. You're pain-free now.
Don't push yourself too hard after a surgery like this. Just give yourself some time to heal. What work says or what not, you
Yeah.
know what pain is
Yeah.
going to stop you, slow you down, or make you worse. So,
Well, this is a good anecdote. I had a patient who was unhappy because he couldn't, year after the surgery, couldn't drive 600 miles with his wife on a bike to a motorcycle rally.
oh,
It's a true story.
yeah.
But it get even better. That patient was 88 years old.
Oh, geez.
So, yeah. So what I'm getting at, the expectation has to be realistic.
Yes.
And I think with the kind of work you do, the realistic expectation is to take it slow and let your body guide you for the activity increase.
Give
So
yourself time to heal.
You got it. Any other question right now?
No, I'm just curious about where the website I can see this on.
It's going to be on YouTube.
Is it
Just,
YouTube?
Yeah, just go on YouTube, look for Inspired Spine YouTube, and you'll have it, okay?
Look for where?
Inspired Spine
Inspired
on
Spine.
the YouTube for patient testimonial.
Can I get that written down,
I
please?
will definitely.